Hi, my name is Heather Flowe. I work at the School of Psychology at the University of Birmingham in the United Kingdom. Today I'm going to be talking about our project on supporting investigations and prosecutions of sexual violence cases in low-resource environments. In particular, I'm going to be talking about gathering survivors' testimony. My co-authors are Lisa Smith and Laura Stevens, and the project is funded by the ESRC. When I say low resource environments, what I mean are conflict, post-conflict societies and humanitarian crises. I'd like to acknowledge our collaborators on this project, most importantly, the Wangu Kanja Foundation and the Wangu Kanja Foundation Sexual Violence Survivors Network. They're working with us to co-develop the project and to implement it. A pivotal moment for the project was the Global Summit to End Sexual Violence and Conflict. The event occurred in 2014 in the United Kingdom. It was the largest gathering of its type. The purpose of the Global Summit is to end sexual violence and conflict and to hold perpetrators accountable for rape. Another objective is to stop the use of rape as a weapon of war. The summit launched the International Protocol on the Investigation and Documentation of Sexual Violence and Conflict. The protocol is designed to help strengthen the evidence base so that more perpetrators can be held to account. Indeed, in very few cases in conflicts around the world are sexual violence perpetrators brought to justice, despite the fact that thousands of people suffer these atrocities. The protocol is important because it sets out the legal elements that have to be proven in order to try a case in an international tribunal. It provides evidence-based guidance for conducting an evidence-based investigative interview for purposes of establishing these legal elements and collecting other evidence that can support a prosecution. The protocol was revised in 2017 and now includes special chapters on trauma and interviewing child survivors. These chapters are important. Child survivors make up more than 50% of sexual violence survivors in conflict. The protocol sets out principles for gathering accurate and reliable testimony from survivors and other bystanders. One of the key principles is that the interviewer do no harm to the person being interviewed. It's also important that we protect the interviewer because at times, running one of these interviews poses considerable danger to both the interviewer and the interviewee. The protocol provides information that's quite comprehensive about how to plan and prepare to conduct one of these interviews. It also sets out principles of good communication and provides an interview structure that's evidence-based in which these skills can be applied. I served as part of the group that revised the protocol, and one of the things that became quite evident as we engaged in roundtable discussions with small and large NGOs from around the world is that there were significant barriers in implementing the protocol. We know from research that's been conducted in psychology for many years that investigative interviewing is a highly specialized skill. It requires extensive training and mentorship, feedback, continuing education, and it's difficult to train people to have these skills even under the best of circumstances in developed countries. In cases of these environments in which the protocol seeks to be implemented, resources are incredibly low. The principles that it sets out, the protocol for conducting interviews, they require practice. Unfortunately, in these situations, the people working for NGOs or small community organizations that'll be documenting cases, they're not going to have the resources to be able to do this. So what can we do to very quickly enable people to document cases and investigate them when resources are minimal? That's the puzzle that we set out to solve in our project. Another important point to make about the protocol is that it has a dual purpose. The purpose of the protocol, on the one hand, is to investigate cases so that they can be prosecuted. However, very few cases will ever be prosecuted. And so the overriding use of the protocol is for purposes of documenting cases. It's important to document cases so that we know when human rights violations are occurring so that we can prevent them. But in documenting cases, the amount of training that one would need to be able to interview a person to collect the required information in a way that's evidence-based and that doesn't contaminate memory and so forth, it requires training, but it doesn't require as much training as it takes to conduct an investigative interview. But the protocol, it has this dual nature because you never know if a case that you're documenting will need to be investigated someday. So you need to be comprehensive and get as much information as you can. And so for that reason, the protocol is incredibly comprehensive. Still though, the comprehensive nature makes it very difficult to implement. And although the FCO, which has produced this protocol, has resources on their webpage, like PowerPoint presentations, and there's even a course that one can take at the ICC, a training course that you go to in person over several days. The PowerPoints are going to be inadequate in terms of training someone in how to do an interview because that requires practice. And with respect to going to the ICC, that's extremely cost prohibitive for the vast majority of organizations around the world. And we know that most people who will be documenting cases are those smaller NGOs, those human rights defenders who are not going to have access to the resources that they need to conduct a proper interview. It's really important, nevertheless, that we find a way to secure and protect survivors' testimony under these circumstances. Domestic cases often involve challenging the testimony of sexual violence survivors. The testimony is challenged on the basis of the fact that the event was highly traumatic. And does that raise concerns then about the accuracy with which the survivor is recounting the rape? There's also questions about memory distortion, false memories that can arise. Forgetting is a key consideration because these cases, if they go to trial, it's often a decade or more since the rape took place. And so the survivor is remembering something that happened a long time ago. And we know from research in psychology that the sooner we can gather an evidence-based, good first account from somebody, the likelier it is that we could help preserve that memory to reduce forgetting. And so it's important that we develop a tool then that can be used right away to obtain a comprehensive account done in a scientific way so that we can ensure that the survivor's memory isn't compromised by the interview itself. I just wanted to add that these domestic challenges that we see, they still arise in an international context. So issues of trauma and memory distortion, false memory, you could find examples of that in international cases. We are working with the Wangu Kanja Foundation Sexual Violence Survivors Network in Kenya to develop innovative methods for documenting testimony. We've begun our project in Kenya because there's incredible will there to improve case prosecutions. There's also the consideration of the place in which you're working. You want to make sure that the rule of law is in operation so that you can give your new method a fair trial. And if it works in Kenya, then the next thing we'll do is we'll try to implement it in other types of environments that may be more challenging to see if it's practicable even under those sets of circumstances. In Kenya, when a survivor reports rape, it's a highly bureaucratic process. It requires the survivor to obtain several different types of forms and visit many different types of agencies. The police may even ask her to put petrol in their vehicle so that they can go and investigate the crime. Prosecutions, they rely heavily on medical evidence, much more so than survivor testimony. In this form here, which is one of the key forms that needs to be completed by a clinician to obtain medical evidence from the survivor, this small area here that I'm highlighting with my cursor, that's all the room on the form for the survivor's testimony. So there's not a lot of space or a lot of consideration given to the victim in being able to tell his or her story about what's happened to them. Very few cases will ever go to trial. Just to give you an example, We visited Nairobi in August, and one of the places we went to was the Nairobi Women's Hospital. We learned from them that there's been about 10,000 cases reported in Nairobi. However, there's only 5 cases in the court system. So that tells you that there's considerable attrition happening with very few cases ever going to trial. So survivors then, they don't have many opportunities to tell their story from the moment that they report to when they see a clinician, and they certainly will not wind up going to trial to be able to testify. Because of this, we have very limited knowledge about the antecedents of sexual violence. What are the hot spots in terms of where sexual violence is occurring so that we can work to prevent it? Who is perpetrating this crime? How are victims being targeted? All of this we need to know if we're going to develop a strategy for preventing sexual violence from occurring in the first place, and also a strategy for protecting people once sexual violence has occurred. We also need to be able to trace cases throughout the system to know why attrition is occurring. At what point are cases falling out of the system? In Nairobi, one of the first steps that a survivor has to undertake is getting a medical report. That information then has to be hand carried by the victim to the police station. The police then have to fill out additional paperwork and hand carry that information over to the court. And then there's going to be several postponements and hearings, and what happens to these cases? Why are cases not making it to the police after a medical report is taken, and so on. So we need to understand this so that we can improve the system's response to survivors. Are they not following through on reporting to the police because of stigma, and that's incredibly likely in the context of Kenya, or is it because the police are disbelieving them? We're working with the Wangu Kanja Foundation to be able to implement a new method for collecting survivors' testimony. The Wangu Kanja Foundation is a nonprofit organization that was started more than 14 years ago by Wangu Kanja, my friend, who is pictured. She survived a carjacking and a violent rape, which gave rise to her starting this organization. When she reported the crime to the police, she was met with skepticism. While the police recorded the carjacking and the robbery, they didn't regard what happened to her body as a crime. So she set out to change things in Kenya and has established the Wangu Kanja Foundation. Its vision is to have a society that's safe and free from all forms of violence. They provide numerous services to survivors of sexual violence, including an SMS texting service where people can report when sexual violence has happened to them. They also create awareness through campaigns that they run, like establishing the Rape Survivors Network and training survivors on the mechanism of legal reporting and rights that victims have. They also provide access to comprehensive care. About a third of children suffer sexual violence in Kenya during their childhood, but only 10% of children are able to have access to professional services. So being able to highlight what possible services are out there for people and to be able to communicate when services are lacking is really essential. So this is very important, necessary work that the organization is undertaking. They also engage in restorative justice programs, advocacy programs, and they help survivors of sexual violence gain financial freedom. One of the root causes of sexual violence is gender inequality. So through economic empowerment of survivors, we can end cycles of violence. So we're working with the Survivors Network to collect data using a mobile app. The survivors are going to deploy the app across all 47 counties in Kenya. Our mission is to collect data on the circumstances of the rape, as well as about the survivor's life before and after the rape. This will enable us to study the impact that rape has on people's lives. The user, the survivor who is out collecting testimony from other survivors, doesn't have to have specialized training. The program uses appropriate questions and prompts to elicit the survivor's account. It's custom built into the app already. The stakeholders that are along the entire referral pathway are involved in the development of this app and in its implementation. These stakeholders include the Ministry of Health, the police, as well as the judiciary. Our long-term vision is that they will use an app like this so that we could track cases throughout the system. So you'd like to see this become an official tool that's used to record cases. By doing so, we'll have a greater awareness of why cases are falling out of the system and where services are lacking. I'd like to thank the Wangu Kanja Foundation and the Sexual Violence Survivors Network, as well as all of the partners who have worked with us to help us understand the Kenyan context.